Welcome to the VSP podcast. Today we're going to be going over arm care and what that means to you as a baseball player, what to look for, how to assess, identify issues, and then prescribe solutions. So without further ado, let's jump right in. So as I mentioned, we're going to be going over arm care. Why arm care is more than just bands and random stretches. That's an important question to ask. A lot of times when I ask athletes what is their routine, before like pre-throwing, they say that they grab their J bands, they attach to the fence, and they start just going through, whatever exercise they've been taught in the past. And it's usually better than nothing, but sometimes they're doing more harm than good. More times than not, when I have them show me their routine, their shoulders are translated forward in their socket. They're not getting correct scapular motion, and they're not effectively going through the right movements to warm up the throwing motion. Sometimes they're creating bad habits, which is never good. Um, and arm care is something that should keep the athlete healthy and promote better movement. Right? We're trying to eliminate some of these bad habits, some of these risks for injury, and things of that nature, which are really important to longevity in the sport. So today, we're looking at three big areas: shoulder, external, and internal rotation, scapular movement and stability, and then the supporting areas. Right, obviously, throwing is a full body motion. So we're going to dive into the thoracic spine, the core, and the hips. So first up is going to be shoulder, external, and internal rotation. This is usually the bread and butter of most arm care programs that people focus on, just because it's the area of rotation, right? It's the area where we see the most motion when it comes to the throw. And sometimes people are lacking both internal and external rotation. Sometimes it's a combination of scapula flaws or thoracic rotation flaws, things of that nature, which obviously are important to the throwing motion. And we like to look at all of that. But when we're talking about just the shoulder itself, we look at the total range of motion. I look typically about for 180 degrees of total range of motion. Often, most people have more external rotation than internal rotation. Very often, not very often, I've seen the opposite. And I'll have the athlete lay on their back and slowly drop down to external rotation and just taking a peek. You could use a tool to measure the external rotation, or you can just go by your eye to see how far down they can get in rotation without compensating, right? Whether that shoulder drives forward to the socket, lower back arches, we want to make sure that they're getting true external rotation, and same for the flip of going into internal rotation. A lot of times, athletes that are in season will start to gain a ton of external rotation and lose that internal rotation. So that's just something to keep note of in the back of your head. Um, when I'm comparing right side versus left side, I look at the throwing side versus non-throwing side. Usually the total range of motion will be the same, but the external rotation will be more on the throwing side than the not throwing side. And it's not, and people always talk about like GERD and having that deficit of internal rotation, but it's typically normal to have more external rotation on your throwing side and less internal rotation, and then vice versa, just because of the nature of the sport. What your body's going through, the repeated action of throwing, we're going to gain that range of motion. So again, I have the athlete lay down on their back. I'll look at the internal and external rotation, see the overall movement quality, if they have any pain with that. And then based on what I see, then I'll start to prescribe exercises. So in their pre-throwing routine, if there's somebody who does lack one or the other, I'm going to make sure that I address it with specific exercises. And I try to keep it as simple as I possibly can. Right? Exercises that they can clearly feel, remember the cues, and effectively translate that over into their extended warm up and then into their throw. So I recommend things like a half kneeling, pole shoulder ER, where they simply put their arm up on a pole and they rotate back. And we could put the link to that exercise below. But using bands sometimes is hard, you know what I mean? Because you have to stabilize your shoulder at the same time that you're going into any sort of rotation. So a lot of the younger athletes don't have that body awareness to do it properly. We'll also prescribe, different things like rhythmic stabilizations and, manual perturbations, for some of our more advanced athletes. So instead of just rotating back, for like a half kneeling shoulder ER, maybe we're having them drop back into lay back, and then we're having, a med ball, in their hand, and we're pushing that med ball around, and they have to stabilize. So there's different ways to challenge internal and external rotation. You get pretty creative, but always start at the foundation and then slowly progressing from there. So after we look at internal external rotation, then we're going to take a peek into the scapula. So, which plays a huge role in supporting that shoulder movement. One of the simplest ways to just take a look at the scap is, if if you have a male athlete and they have no shirt on, you can see, typically you can see if that scap is hanging off the back, and typically that will show that they're unstable. There, right? We want that scap to be hugged along that rib cage so it can effectively glide, right, as that shoulder moves, and support that shoulder in the throwing action. And for our most of our hypermobile athletes, that scapula is not hugging that rib cage. They're not getting that congruent movement as they, load that scap and then unleash into the throw. So we like to take a look without a shirt if it's a male athlete. And then we'll go into some movements, right? Things like wall slides, or just simple angels or shoulder flexion, just to see how that scapula is moving. Are they getting sufficient upward rotation as the athlete is moving their arms over the head? And if they're not, of course, we're going to prescribe the exercise, right? Whether it's in their pre-throwing routine or just throughout their normal strength exercises. Things like wall slides are great, prone trap raises. We look at it, right? We need to make sure that scap is moving, but the only way it's going to glide along that rib cage is if we're getting the scapula tilt that we want, right? For athletes who are hypermobile and that scap is winging, um, they're stuck in an anterior scapular tilt. We want more of a posterior. And like I said, things like a prone trap raise, or prone eye-wise T's, W's, those foundational exercises that people use a lot for the upper back, are great to teach that. It just needs to be done properly, right? We got to make sure that that scap is tilting along with that shoulder getting pulled back, so everything could work together. Because again, we're trying to groove those patterns. So definitely always take a look at that scap. It's really important when it comes to shoulder health, because the more that scap can stabilize the shoulder, the less stress, typically to the front of that joint, or just in general to the rotator cuff. Okay, so now talking about the supporting areas, which are just as important. So starting at the top, looking at the thoracic spine. People talk a lot about shoulder hip separation. We want to make sure that that thoracic spine is able to rotate. Using a simple, seated T spine rotation, where I'll put like a yoga block in between an athlete's knees. They'll squeeze it, and then they'll have a dowel on their upper back, and they just rotate. I want to see how much rotation do they have, one side versus the other. Again, typically, like I was mentioning with the external rotation earlier, you'll have more rotation through your throwing side. So that's just important to take note of. If you have somebody who's, pretty locked up there, we need to prescribe some exercises, things like T spine open books, double reaches, wall T spine rotations. Again, exercise that we can certainly put below, but just to expose them to proper upper back T spine rotation. Because if you're not able to rotate through that upper back properly, you're going to end up relying on other areas, maybe like your lower back, to rotate through. And that's where, you can see, pars fractures and other lower back injuries that nobody likes to deal with. So make sure that you take a look at that T spine, and then put those exercises, whether it's in the arm care routines or just in their everyday warm. Then looking at the hips, we definitely need to make sure that we're moving well through the hips. What is well? So like look at the hip internal and external rotation, hip extension, hip flexion, right? Those are typically the areas that I'm going to be assessing for an athlete. And if they're limited in one, right, if they can't rotate into that one side, again, they're going to compensate. They're not going to be able to sequence their body the way we want them to, which in effect will either potentially get hurt, or just they're just not going to be able to throw as hard or as effectively. They're going to get fatigued much quicker. We want their body to be very sequenced, right? Everything, we if you ever look at like a kinematic sequencing chart, which Dr. Greg Gross popularized, through On Base U and his TPI, they show these charts, and most elite pitchers actually look the same on these charts. And what it's showing is the way the energy is flowing through the body, how everything should start from the ground, work towards the legs, the hips, the trunk, shoulder, and then finish with the elbow and the hand. Right. That's how the energy should typically flow when it comes to the throwing motion. And if you take like a 15 to 16-year-old kid, that's going to be all over the place, right? The energy is going to be flowing. They're not going to be necessarily rotating and moving as efficiently as some of the elite pitchers are. And that just goes to show you how important it is to make sure that in total you're addressing the body right from a mobility and stability standpoint. Make sure everything is strong, not just your shoulder. We're not just yanking on bands and warming up trying to just like crank on our shoulders prior to throw. We're looking at the body as a whole, right? It's a comprehensive approach. Arm care, right? It starts with the legs and finishes with the arm. It doesn't start with the arm and stay in the arm, right? Like you have to really understand that when it comes to arm care. And you have to be also educated enough to identify these issues, right? Whether it's a shoulder rotation issue, thoracic rotation issue, scapula tilting issue, maybe it's also an ankle issue. Maybe you don't have enough dorsiflexion. There's so many different areas that you can assess that can negatively impact somebody's arm. So make sure you understand what you're looking for, so you can cue it, progress it, and hopefully figure out a solution. So what I'll leave with you today is don't just be that kid that's cranking on bands. Have an educated approach to your arm care. Think about what do you need in order to be successful. Doesn't matter what that guy across the park is doing, or your teammate next to you. Doesn't matter what they're doing. Go to a professional, figure out what you need to do in order to be successful, and I guarantee it will result in better velo, better movement, and more importantly, better baseball. So if you have any questions, please reach us by the link below. Shoot us an email, info@vsptraining.com, and we'll see you next week. Take care, guys.